Hi you guys, and welcome back to the channel. If this is your first time seeing me, then hello. My name is London and I am a labor and delivery nurse who is passionate about educating women through pregnancy, labor, and postpartum, and also breastfeeding. So if you are not already following the community, do not forget to give this channel a follow, and let's go ahead and get straight into the video. We are going to be talking about how to go into labor naturally. So I'm going to be breaking this video down into 3 different sections. The first thing that we're going to be talking about is how to get your cervix to be in the best position and also the baby to be in the best position. The second thing we're going to be talking about is what to do to actually thin your cervix. And then the last thing we're going to be talking about is what to do to help your cervix to dilate, to create contractions, to release oxytocin naturally. So if that is something you're interested in, then just keep it right here. To get your cervix to be in the best position and also to get the baby to be in the best position, you want to do a couple things, okay? Number 1, you want to start exercising. Exercises that I will be doing to get my baby to be in the best possible position is walking, going for long walks. There are studies that have shown that going for long walks really helps bring the cervix down, really helps the baby get into a nice position so that when you do thin your cervix and when you do create these contractions, your baby and your cervix can be in the optimal position for natural labor. The other thing that I will be doing is really taking advantage of a birthing ball. Birthing balls also really help the baby to come down and also your cervix to come down to get in the best position. The next thing that I will be doing is labor circuits. Now, labor circuits are really for the baby to get in the most optimal position. And what is the most optimal position for a baby? You want the baby's chin to be tucked like this. You want the baby to be head down, and you also want the baby to be looking towards your spine instead of the baby looking up at the ceiling. And a lot of babies, especially first-time mamas, they're looking up at the ceiling, which can create a longer labor for you. It also can create a lot of back pain in labor. And it also can create a prolonged time in pushing in the second stage of labor. So you really want to make sure that the baby gets in an optimal position, or just try to do your best, right? You can't really do what you can't do, but trying to do your best, especially with those labor circuits, they're going to really give you your best foot forward and trying to get the baby in that optimal position. Going into number 2, which is cervical thinning. If I were trying to get my cervix to thin, these are the things that I will be doing. Now let's just first explain what cervical thinning is. Cervical thinning is the effacement part of a cervical exam. And effacement basically just means thinning. Now, you want your cervix to be thin. When your cervix gets nice and thin, we call it ripe. It gets ready for the dilation. It gets ready for real labor. Cervical thinning is really what happens in early labor. And it is something that takes a very long time to do. That is why the early labor stage of labor takes so long, because you're trying to dilate and also thin the cervix, and that can take a while to do. When you are trying to go into labor naturally to give yourself the best optimal cervix, you want to focus on thinning, okay? And the things that I will be doing to help thin my cervix is, number 1, I would have some dates for my dessert, except for if I am gestational diabetic or if I have diabetes. If I have gestational diabetes or I am a diabetic, I would consult with my provider before consuming dates because they are sweet and can increase your blood sugar. But if that is not the case for me, I would be consuming at least 6 dates to kind of help ripen my cervix. Some people say 3 dates, some people say 3 to 6. To give myself the best chance, I would be consuming about 6 to help ripen my cervix, and I would just use these dates as my dessert. That's how I would be incorporating them into my life. The next thing that I will be doing is consuming red raspberry leaf tea. Red raspberry leaf tea has been known not technically to induce labor, but to help the uterus get ready for optimal contractions, which basically means strong contractions, and also to help thin the cervix. So that is what we're trying to do in this stage. So I will be consuming at least a glass or 2 of red raspberry leaf tea. I would wait until I consult with my provider about when to start these things, but just remember that it takes time for your body to go into labor naturally. It also takes a lot of time for your cervix to thin. So you want to start consuming these things if you are trying to go into natural labor. I would say either at the 36 or 37 week mark to give yourself the best chances. But before you do any of these things, definitely consult with your healthcare provider. The next thing that I will be doing is using evening primrose oil. Evening primrose oil has been shown to help thin cervixes. This is another very natural remedy. A lot of midwives use evening primrose oil. So I would be using evening primrose oil to also help aid in thinning my cervix. Another thing that I would be doing is having intercourse, because semen has been found to be very high in prostaglandins, and prostaglandins are used to thin your cervix, okay? So that is another thing that I will be doing to help aid in thinning my cervix. The last thing that I will be doing is hot baths. Hot baths really, really relax you, make you feel comfortable, make you feel safe, and kind of sometimes they can make you kind of feel happy. And they naturally can release oxytocin, believe it or not, and it can help thin your cervix. Not enough to really drive you in labor. That's why I didn't put it in the labor aspect, but it can really help in thinning your cervix and relaxing you and letting your body know, hey, we're safe to go into labor. We can do this. So yeah, I definitely would be partaking in hot baths. And during my research, I was also researching that enemas can be used to help thin and kind of drive you into labor. This used to be used way back in the day. They used to give them enemas, and a lot of women would go into labor after receiving the enema. So it's very interesting to know that research is still looking at that. So I don't know if you want to give yourself an enema though. So that's why I'm not really including it, but I thought it would be interesting to talk about since we are discussing all the ways to help induce labor naturally. Going into number 3, and that is releasing oxytocin to help induce labor, right? To help get those contractions to be strong, regular, and help use those contractions to change your cervix. Because here's the thing, when you have strong, regular contractions, they should be changing your cervix, and that is what we want. Naturally, as women, we release our own oxytocin, okay? Now, how you can increase releasing your own oxytocin to get those contractions to be strong, to let the body know, hey, we're trying to gear up for labor. Number 1 is nipple stimulation. I have had tons of patients who have used nipple stimulation to really get themselves to try to contract on their own. However, nipple stimulation alone, I've never really seen it work alone. It's usually in a combination of things, such as some of the things we just discussed earlier. Another thing is castor oil. Now, this is a controversial thing, and I am not in any means telling you to go ahead and partake in castor oil. Please speak with your provider to really understand the risk versus benefit of castor oil. But during my research, I really found out, number one, what castor oil is. And castor oil is a laxative, very similar to the enema aspect. This laxative can help create uterine contractions that can be strong enough to help the body go into labor. There are several risks associated with castor oil, and that is why there's so much controversy when it comes to castor oil. Some of the risks include diarrhea. Yes, it is a laxative. It can make you do that. Another is nausea, vomiting. Because it's causing so much uterine contractions, because you're kind of pooping a lot, it can cause that as well. It can also cause an imbalance in your electrolytes because of the constant diarrhea if you take too much. That is why it is very important to speak with your provider prior to consuming castor oil, because you do not want to take large amounts of it. You do not. Usually 1 to 2 tablespoons is it. You do not want to drink a cup or have several tablespoons of castor oil, because you will more likely see some of these effects that many women do not like. However, please speak with your provider before consuming castor oil to really understand the risk and benefit. And the last two things is acupuncture and transcutaneous nerve stimulation. In my research, I found that both of these things can really help, number one, thin the cervix and also release oxytocin, helping women to go into labor naturally. If you have found this video useful and helpful, do not forget to like it. And also, I would love for you to stay around and stick around within the community. I have so much information coming in the near future that is going to help you during pregnancy, during labor, during the postpartum stage, and also during breastfeeding. My goal is to help women make educated and informed decisions so that they feel empowered when making their decisions. If that sounds like a community that you want to be a part of, do not forget to go ahead and subscribe, and I will see you guys in my next video. Bye.